am Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. What is thrombophilia and can it cause recurrent pregnancy loss? Does it have an effect on infertility? This is the topic for today. Thrombophilia refers to a group of disorders that increase an individual's tendency to form abnormal clots. These disorders can be inherited or acquired and often involve abnormalities in the coagulation system, leading to increased risk of venous and arterial thrombosis. Recurrent pregnancy loss is defined as the occurrence of 2 or more consecutive pregnancy losses before 20 weeks of gestation. While there are many potential causes of RPL, thrombophilia is recognized as a significant contributing factor, particularly when other causes have been excluded. So what are the types of thrombophilia? Let's talk about the inherited thrombophilia first. Factor V Leiden mutation. A mutation in the factor V gene increases resistance to inactivation by activated protein C. This leads to hypercoagulable state. Then there is prothrombin gene mutation G20210A. This mutation increases prothrombin levels, enhancing clot formation. Protein C, protein S and antithrombin deficiencies. These are naturally occurring anticoagulants and their deficiency can lead to an increased risk of clotting. We talked about inherited. Now let's talk about acquired thrombophilia. Antiphospholipid syndrome, APS. It's an autoimmune disorder characterized by the presence of antiphospholipid antibodies which increase the risk of thrombosis and pregnancy complications including RPL, recurrent pregnancy loss. Hyperhomocystinemia is also where elevated levels of homocysteine amino acid can damage blood vessels and increase the risk of clot formation, something that thrombophilia is known for. What is the impact of thrombophilia on pregnancy and fertility then? Placental insufficiency. Thrombophilic disorders can lead to abnormal blood clotting within the placental vasculature. This can result in poor placental blood flow, leading to placental insufficiency, which can cause pregnancy loss, preeclampsia, intrauterine growth restriction or preterm birth. The presence of thrombophilia is associated with an increased risk of recurrent pregnancy loss. Inherited thrombophilia such as factor V Leiden mutations and prothrombin gene mutations and acquired thrombophilia like APS have been implicated in RPL. It can cause implantation failure also. Thrombophilia can impair endometrial receptivity and embryo implantation. The hypercoagulable state can lead to microthrombi formation in the uterine vessels, resulting in reduced blood flow and nutrient supply to the developing embryo, thus affecting implantation and early pregnancies. While the primary focus of thrombophilia in pregnancy is on the uterine and placental blood flow, there is some evidence that thrombophilic disorders can also affect ovarian function. Poor ovarian blood flow may impact follicular development, ovulation and corpus luteum dysfunction. So how do we diagnose it? Diagnosing thrombophilia involves a combination of clinical history, family history and specific blood tests to identify genetic mutations and antiphospholipid antibodies. Women with a history of RPL, current pregnancy loss especially, those with unexplained losses are often tested for thrombophilia. Management strategies aim to reduce the risk of clot formation and improve pregnancy outcomes. The pregnancy outcomes could be done by low-dose aspirin or anticoagulant therapy or heparin, which are commonly used to reduce clotting risk in women with APS. This combination in such women has shown to improve pregnancy outcomes significantly. Women with known thrombophilia are closely monitored during pregnancy for signs of complications including placental insufficiency and preeclampsia. Smoking reduction or totally giving up smoking, maintaining a healthy weight and regular exercise can also reduce the risk of thrombotic events. In cases of hyperhomocystinemia, folic acid supplementation can help lower homocysteine levels. So does it have an impact on infertility? It can have an impact. As discussed, thrombophilia is associated with recurrent pregnancy loss, which can be a barrier for successful conception and full-term pregnancy. But in these women, thrombophilia plays a crucial role in reproductive health, particularly concerning recurrent pregnancy loss and pregnancy complications. While it may not be directly the cause of infertility, its effect on pregnancy outcomes and potential complications during also infertility treatment highlights the importance of early diagnosis and appropriate management. If you wish to know more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.